why would I want needles all over my body? Acupuncture. Is it a placebo? Or is it the best thing you can do? Or is it somewhere in the middle? It's a question we're exploring today on the Be Well Now podcast. I'm Nick, the Curious Patient, joined by Dr. Ron Dumar.
Hello, everyone.
You are the guy that I've come to for acupuncture, and it's helped me tremendously. But I have no idea what it does, and I know people who are so afraid of needles, and so I wanted to talk to the person out there who's never done it, who might think that the studies that it helps are dubious at best. What is acupuncture, and what have you seen it do for your patients?
Yeah, so acupuncture, what it is inserting needles, very small, thin needles, which who wants needles inserted into their skin? Into your skin, just under your skin. And that's acupuncture. So what does it do? When you read about acupuncture and you read about acupuncturists in the past, or you pick up a book from a physician several hundred or even 1,000 years ago, you'll realize that they were studying the effect of insertion of needles under the skin for virtually any ailment under the sun. Now, for some of them, they worked really well. For others, they didn't work so well. And so what we do as modern acupuncturists now is we look at that knowledge that's been gained over the past 2,000 to 5,000 years, and we assess how did it work for them, what were the best outcomes, and what were the points and specific areas that they were utilizing to get those outcomes. And that's what we learn as acupuncturists through our training, and that's what we demonstrate through our testing and standards and certifications, that we know how to identify those specific points to address ailments in patients.
In a quick Google search I saw on Johns Hopkins that there are 2,000 or more than 2,000 acupuncture points connected by pathways or meridians. They create an energy flow called qi, and that acupuncture can work on all kinds of ailments, from nausea caused by surgery, dental pain, addiction, headaches, menstrual cramps, fibromyalgia, lower back pain, asthma. It all sounds too good to be true, and it all sounds like very difficult to prove.
Yeah. So that has been the problem for a long time, is for a researcher, how do I prove this? Because we stick needles under people's skin or insert needles, right? You still have a part of the needle above the skin. We're not inserting needles and leaving them. You'll stay in acupuncture or have needles on you for about 20 minutes. That's a course of the therapy. But it's difficult for researchers to say, what do we get out of this, right? And is there a level of consistency, and how do we define it? So thankfully, there's a lot of really intelligent and smart researchers out there who can look at and minimize certain factors and say, okay, we're going to really just try to study this aspect of it. Acupuncture has an overlapping benefit to a variety of different conditions. And the reason for that is because when you insert a needle to a distal point that's supposed to have an effect on a meridian, as you're saying.
Which I don't even know what a meridian is.
Yeah, and you brought that up, and I'm getting to that, right?
Okay.
So essentially, when I insert that, it has an effect on that meridian pathway. That meridian pathway leads to some sort of central system, and then that central system goes out and has an effect at a different location, okay? So when I was studying, I actually was studying Western medicine and Eastern medicine at the same time. And I would sit in my Eastern medicine classes, and we'd be talking about qi, we'd be talking about energy, we'd be talking about meridians and the smooth flow of nutritive fluids and all of this stuff. And I'm like, what are you talking about? And then I'd sit in my biochemistry and physiology and biomechanics classes, and I'd say, okay, I can see that. I understand that, because that sounds like the way we've described the body in Western society. Well, finally, I started to realize that Well, the smooth flow of nutritive fluids essentially means that I want my blood flowing at a very nice viscosity. I don't want it too thick and I don't want it too thin. And if there's an organ that's responsible for doing that, it probably means that that organ cleans up in some part the blood. Well, we do have organs that do that. We do have certain compounds that are made by organs that perform that function to make sure that there's a smooth flow of nutritive fluids. And if we don't have a smooth flow of nutritive fluids in Western biochemistry, physiology, we'll give you something like a blood thinner, right? Or we'll give you something like a diuretic, right, to take some of the fluid out. So we either want to improve the flow, or we're saying, there's way too much water in the system, so we're going to decrease the water.
So improving the flow happens through acupuncture and doing something to these meridian points?
Exactly. So each of the organs in the body are linked to neurology. And that neurology has a central point that it goes back to, which is the brain. And the brain reaches all the way out, you could say, through nerves. Anybody who's ever had a stinger or fell and, oh man, I have felt a shock all the way down my finger or down into my foot, or if they've had a disc injury, they'll know that very quickly, hey, there's a relation between my spine and my nervous system and my extremities. People often ask me, well, how can I know that this point out on my hand or my fingers is actually relating to something in my brain? And I say, you don't know. But if you think about it embryologically, when I am first starting out as a cell, the very, very first thing to form embryologically is the nervous system. So the nervous system has a forebrain, a midbrain, and a hindbrain, right? And essentially those are three pieces of neurological tissue that begin to invaginate or to fold on each other and then to spread out to create what will soon become our brain, our central nervous system, and the spinal cord. Okay. Now from there, all it does is reach out these little branches, like a tree reaching out its branches, to extend itself to organs, to initiate the production of organs in the body, the heart, different tissue. It will reach all the way into the extremities, all the way out to your toes, because the nervous system is really directing the development of all of that tissue. So now that we've established, at least that we agree on, Western medicine and Eastern medicine, that there is a singular place that we can go back to that relates to everything in the body, every tissue. There's an awareness in the body of every tissue that exists in your body, right? So all I have to do now is if I can identify a place in the body that relates to or sends a signal back to the brain that actually has a relation in that part of the brain to a specific organ in the body, well, now I can treat and improve the function of your organs. So if your blood happens to be at a place, going back to the blood example, where the viscosity is kind of cloying or it's getting maybe sticky or a little bit clotting-like, I can use acupuncture to influence the factors in the body or the organs in the body that would be developing compounds and chemicals to help change that or have an effect on the blood.
So what's happening? You're putting needles. Why are you choosing certain locations? It's not going to be a panacea and work like a Advil and all of a sudden, your headache goes away, right? So what is the time commitment? How does this work over time versus one session? Give me a sense of my doubting mind having some sense of resolution or insight.
Yeah, so we're talking about, or have been talking about thus far, acupuncture in a very didactic way or a very left brain way, right?
Yeah, exactly.
And so you have to also look at acupuncture as an art. And I think that every medicine practitioner that has been successful in medicine and understands medicine and his patients realizes that there is a significant science to what they do, but there's also a significant art, and that's for all of medicine. And if you leave the art out of medicine, then you don't practice medicine anymore, right? You're really just practicing a process that you were taught. And you might as well, it could be a process you were taught at McDonald's, right? It's just a process that somebody said, okay, bam, 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 this is what we do. Okay, for this, you plug in that. But what happens to listening to the directives of the patient, right? That's where the art comes in. And anyone who's been to a doctor knows that when they present themselves, they say, hey, I'm feeling this and this and this. And very often they'll get the response, you're fine. Everything looks good, right? And that's where the art can start to take place. Okay, according to science, according to all the didactic, according to all the left brain studies and reading and understanding, everything looks good. You're fine. But now what about your symptoms that you're feeling? What do we do about those? And how does acupuncture work is what you're saying. Essentially what we do, and as acupuncturists, is a very standard, typical thing is you'll come in, you'll have a relaxing place to either sit down, lay down, recline, and then the practitioner or the physician will insert needles into the skin. So these needles are about an inch long, half an inch sometimes, and depending on the area, or if you have something like sciatic pain, it could be a little longer because of the area that they're trying to go through more tissue. But when I insert the needle, I'm trying to get a response. And in Eastern medicine and Chinese medicine, they often call it the qi. Like you're looking for, when you insert the needle, the qi response. And so this is a little grabbing sometimes of the needle, like there will be fibers under the skin and it will grab the needle. The practitioner will feel it. For me, I like to say, because of the way I explain acupuncture and the way I understand it from a scientific standpoint as well, is that I'm trying to get close enough to a nerve to have an effect on that nerve so that nerve sends a signal retrograde back to the brain in that specific region of the brain to have an effect on an organ that I'm working to impact.
And this is based on thousands of years of practicing acupuncture, where certain these meridians are linked to organs?
Yeah, and I'm using meridians and nerves, interchangeably.
Because we're talking to a skeptical audience that wonders if this stuff is just a placebo.
Right, exactly. So you have to look at it like nerves, and if I hit my thumb on the door, that hurts. Well, it's not just the fact that I hit my thumb on the door or slammed it in the door that made it hurt. It's the fact that my brain understands that I hit my thumb and it shouldn't be hit. And when it gets slammed in a door, usually there's some sort of damage that's done. And I need to be aware of that damage so that I can take care of it. Well, if we start to lose awareness of any piece of our body or any part of our body, if we lack awareness of that through the nervous system, then that means essentially we're not able to properly care for it. And if we start losing the ability to properly be aware and therefore properly care for our body, then, well, it all goes downhill from there. So acupuncture, this is where we start to get to some of the art of it. What I say to a lot of patients, and I encourage my patients to get to a space where acupuncture becomes a practice and it becomes an art of achieving awareness for them, where they're becoming aware of a new path of wellness, a new path of health, a new way of seeing their body, and a new way of experiencing life. I'll say to them, acupuncture is a coach because what it does, and what we actually know that it does through scientific research, is it will regulate heart variability. So if you have an erratic heart rate and you insert needles, it will help to regulate the heart rhythm. So we've seen those that research done in research trials. Okay, so what that means essentially is that we know acupuncture has a specific effect on the autonomic nervous system, or your rest and digest, fight or flight nervous system of the body. So if I'm in a flighty panic, I'm anxious or I'm nervous all the time and I feel stressed and overwhelmed, well, that's a fight or flight type mode that I'm in. And acupuncture, receiving acupuncture, can actually help me achieve more of a balanced mode of my nervous system. So it can give me that experience. And if I have that experience, then my body can start to become more aware of what it feels like to be in balance. And the more I practice being in balance, the more I can carry that with me throughout life. And so what I tell patients is I want them to be able to be in a state of balance, so that acupuncture is not going to get rid of your stressors, but what it will do is fortify you against them so that you can remain in a state that's more calm and navigate through those stressors.
Well, it reminds me of meditation where you focus something. The breath is probably the most common.
Mm-hmm.
And it's not because the breath is anything, well, it probably is. It without it, we don't live, but it's an effective tool. So you let go
Mm-hmm.
the nonstop thoughts. Maybe there are other philosophies on this, but I think it's just, hey, the mind's going to do what it's going to do. People say calm the mind. And in my head, I'm like, I'm not sure how to calm the mind or if I ever can, but I can come back to my breath and let those thoughts go and be okay with it. Not push them away, but understand what it's like to have all these external things happening and have an anchor somewhere. And obviously people do meditation, and for me, it typically calms me down. But the idea is to take it off of the pillow or the chair and bring it into your everyday life. Mm-hmm. And it's sort of that practice. And in a lot of ways, that's building awareness, because when you're still, it makes the moving more vivid, but it also gives you a chance to check in with your body and everything that's going on. And it can be really difficult, and there's lots to say about that. But when you talk about bringing awareness through the practice of acupuncture, my skeptical mind, my thinking mind says, how is this a practice? I'm just sitting here. I'm not doing anything. But now that I understand what you're saying, that you practice what this feels like, and maybe your body gets a sense of what it feels like, and through that practice, you can take it out of the acupuncture chair. Respond to that if you could. And then the other thing is, I've done a lot of one-on-one acupuncture in my day, and it gets expensive, anywhere from whatever, $60 to $90, depending on where you live. You're in the room for an hour. But you have community acupuncture, which I thought has been incredible, and it encourages you to actually practice. It's a much more reasonable rate. You sit in a room with 5, however many individuals. You're laying back in the chair. It is so relaxing. I'm curious what you think about everything I just said, it being accessible in a community setting, and then also the idea of it being a practice, yet passive.
Yeah, and I think that those are both very good questions and great points to bring up, because acupuncture is a practice. It's a lifestyle. It's a way of being. And we hear, yogis talk about this. You hear meditation gurus and, everyone's talking about this path of life and living. And really what we're in Western society seeking is some semblance of peace and neutrality, so that we're not so overwhelmed. Sorry, that's my phone. I'm in my office right now, but
this is a busy man. He's known as the Heber. We live in Heber City, the Heber healer, and patients are starting to arrive. So I feel so grateful for your time. Do we have any more time, or do we need to continue this conversation at another time?
Just one more point. I think we are doing okay. They'll come get me as soon as we need to stop. But your other point was with regards to community acupuncture as well. So it is an art. It's a practice. It's something that we want people to engage in. And to engage in, well, let me say it this way to you. People who start to exercise, they realize, oh, there's something I was missing. It feels a little sore at first. Maybe they don't like it. But once they get through that part too, they start to feel, I feel pretty good. And then I'm getting stronger. My muscles are building. My capacity to lift, to get through the day. I actually have more energy. I can think better. All of those things begin to improve through exercise. Well, similarly, through practicing acupuncture, those nuances go to a higher level, a heightened state. So your ability to act in a way that is calm and collected through a difficult, stressful situation is regulated in a lot better way now because you've practiced your heart rate and your heart rhythms being at a more neutral, balanced state.
So do you want a patient to come in with that intentionality, or do you just want them to experience this? Because I'd never heard this before. I felt like it worked super awesome for me, but I didn't know that I'm supposed to be like, okay, remember how this feels, and then let's bring it into life, because that feels like a lot of forcing and trying, and that probably doesn't serve me all that well if I get frustrated and then build a cycle of agitation and goes from there.
Yeah, so I want patients to experience it. We don't need them to necessarily when you ask that question, a lot of things go through my mind because people do come in usually saying, I want a specific thing taken care of. Then the more they come in, the more they realize, okay, because I have a sheet that they'll write down on and we'll talk about things. So usually people will come in and they'll say, I have a pain and I want you to get rid of my pain. That's usually how acupuncture works. Okay, let's do 3 or 4 visits, right?
And instantly I'm like, oh, this guy's trying to get me on a plan. You know, he can't just fix me in one. He's trying to steal my money.
Yeah, so
I don't think it quite like that.
3 or 4 visits is pretty good. And if you don't give acupuncture 3 or 4 visits, you need to at least give it 3 or 4 visits. And give it 3 or 4 visits, see what happens. And then usually what people start doing is they go, hey, could you also help with this? And oh my gosh, it's fatigue, or I'm feeling a little bit like I might be coming down with a cold, or, and all of a sudden there's a novel of things that are written down, and they begin to realize, hey, this is a whole body balance type of treatment. This is not just about, hey, get rid of this specific thing now, which it can do and can benefit that. But the really exciting benefit long-term and in a longevity type of sense is this can affect my whole body wellness. If my nervous system is balanced and my heart is regulated, isn't every piece of me going to be benefited? If my blood is moving through the body at a better rate, if the compounds of the organs that are being produced, the chemicals produced by organs, are being produced at a more balanced state, if my organs themselves are not as tense and stressed because of the heart rate variability regulation that has occurred, is that not whole body better? So then once you realize that, you start realizing that, oh, this can be good for headaches or migraines. This can be good for maybe some nausea. This can be good for my immune system and my immune response. This could be good for my rash. This could be really good and beneficial for, pregnancy. There's so many things that acupuncture can be beneficial for. Once you get to that point where you realize that it's basically an underpinning benefiter to the root of the body, right? To the nervous system and to the cardiovascular system. And if you have a healthy communication between the nervous system and cardiovascular system, therefore, throughout the entire body, everything's being regulated at a lot better rate. Is not everything affected or impacted?
There's a lot of layers to this. There's the doorway through which acupuncture can lead you to more. There's the fact that you walk into acupuncture, and if nothing else, you get a nap in or you feel more relaxed. There's to me, it's science on the Western end, and then on the Eastern side, it makes sense, but it sort of feels ethereal. And isn't life sometimes something that words don't always quite do justice to? It all feels right to me, but it's happening at a lot of different layers at once.
Yeah. And if I can share one more thing that would be good for people to know right, about acupuncture, because I have talked a lot about the nervous system, a lot about the brain, a lot about the heart. There is, and the reason I talk about the nervous system, and I like that a lot, that method, that approach a lot, is because you can find research studies, and I have them, that have actually been performed using imaging, functional magnetic resonance imaging. That's MRI studies of the brain. What does somebody do as soon as they think they have a problem with their brain? It's either a CT scan, some sort of MRI, right? So we trust it for a problem. We trust that imaging, the Western medicine. Well, we took this same imaging, MRI imaging, but it's called functional MRI imaging. We use it a lot in like cognitive deficit related patients or concussion patients to see which parts of the brain are firing adequately or which ones are being shut down or have been impacted by the collision, right? So we took functional magnetic resonance imaging study, and we said, we're going to test acupuncture. So we may not know exactly, which is where we have been for a while, how acupuncture works. We know that it's worked and people have benefited from it for thousands of years. It wouldn't be around still if it didn't, right? It's led the test of time. It's met the test of time, and it's still around. So we want to find out, okay, how is it working? We shine a flashlight in the patient's eyes, and we see through functional magnetic resonance imaging the part in the brain called the occipital lobe that is related to the eyes. It lights up. We get all this signaling. Okay, we can see it happen. And then we blindfold the patient so that there's no more signaling through the eyes. And we insert a needle down on the leg, just above the ankle on the outside of the leg. We insert the needle, and we get the same response in the occipital lobe, specific to the eyes. That's cool, right? So we had an impact on the nerve that sent a signal to the brain that elicited the same response as shining a flashlight in the eye. So we know that we're signaling to the occipital lobe specifically, which means we're telling the brain to improve the function of the eyes, right? So this is at least in one way that we know acupuncturists can have a benefit to the nervous tissue that impacts the health of the eye. We did it also with an auditory, right, an acoustic sound, where we made a loud sound in the ear, and we recorded that, and then we occluded the ear, and then we inserted a needle in a point on the foot that was related to hearing. Now, some of these areas, we got some crossover because they are distal. They're so far, they can cross over to other maybe beneficial areas as well. So it wasn't necessarily just the ear. There was a little bit of other crossover in that one as well, but it covered that region specific to affect the ear and hearing. So through that type of imaging study, we learned about acupuncture, that there is a very scientific basis for it. There's a very scientific understanding of it, even though we still don't completely understand the depth and the breadth of the art of acupuncture. And the art of the acupuncture is where I want all my patients to get to, because that's the most powerful place to be. I feel like it's the most independent and empowering place for them to be. It's almost like taking the training wheels off, right? Where the patient begins to realize exactly and become aware of how they felt during the acupuncture and the impact that had on their body and how it impacted the stressors that affected them throughout their life after the acupuncture. And then they have a cue that says internally, I need to go get acupuncture again.
I'm going to share one out there story, and then I know we got to go. I noticed through community acupuncture, it's very accessible. I can get there every week. You buy the punch pass, and community acupuncture exists in communities all over the country. So I would encourage folks to go out there and find it. That's how I got myself to sit in a chair every week for a couple of months in a row. And one time, it was about a minute long, and it was the most profound thing. I felt this great equanimity and stillness. It wasn't euphoric. It wasn't down in the dumps. It simply was. It was peaceful. It was stillness. It was, as Ram Dass talks about, loving awareness. And I felt in an amount of time that I can't quite explain. It started with the ceiling starting to move a little bit, almost like a psychedelic type experience. And then I felt this calmness. And all I can tell you is it felt like I was in touch with all being one at the same time. And I will never forget that, because if that's what it all is, and God, and we're all part of that, and whatever I'm saying may not make sense to you out there, but I got there through acupuncture, and I will never forget that feeling and a belief that that is. Mm-hmm. It just is, and we all are, and I felt it, and I can't explain it, and that's some of the beauty and profundity of life.
Yeah, and that's the art of it, right? That you had a great experience, and that's what we would hope for all of our patients. Not everyone experiences it the same, but everyone does benefit, in my opinion, from it, whether they feel it necessarily or not.
You can reach us at bewellnowpodcast@gmail.com. Again, that's bewellnowpodcast@gmail.com, where we want to encourage people to live in the now, to be present, to awaken and be aware, and also promote health. And there's so much more to say, so if folks have questions, they can email us.
Yeah, let us know if you have any questions, or if you even have some topics that you want us to cover and talk about. We'd love to do it.
All right, Mr. Ron Dumar, Dr. Dumar with Community Health and Wellness in Heber. Thanks for your time today.
Thank you. Have a great day.